Hi, everybody. Welcome to episode 3 of Keeping It 100. I am Dr. Kristin Motley. Now, today I actually had a different topic plan, but my husband had sent me a text over the weekend saying that Tracy Braxton had passed away of esophageal cancer, and I could not believe it. So I looked it up to confirm on some other websites, and I saw that it was real. I was like shocked. So I said, we have got to do a cancer show today. So many people have died of cancer around us. My uncle died of prostate cancer. His birthday was last week, so I was just thinking about him. My aunt died of gallbladder cancer about 2 years ago. A good friend of mine who survived 3 strokes in her 30s, she died of cancer when she was only 43. We all know that Chadwick Boseman died of colon cancer when he was only 43. Tracy Braxton was only 50. I'm sure so many of you have friends and family who have been diagnosed with cancer or who have died from cancer. And it is just too much. And so we know that cancer does have a genetic component to it, so it can pass down from generation to generation. But we also know that there are things that we can do to lower our cancer risk. And so that is what we are going to be talking about today, because there's so much information out here, and we need to make sure our people have the information so that we can be doing the right thing, moving in the right direction, changing our genes so that we're not passing down this stuff to our children, our grandchildren, our great-grandchildren. But before I introduce today's guest, I want to just take a minute since we're talking about cancer, to share some information in case anyone currently has cancer or is on chemotherapy or have a weak immune system for any other reason. It's really, really, really important that you get all the doses that the CDC recommends for your COVID vaccine. This is really important because your body if you have a weak immune system, you are going to have a really hard time trying to fight COVID. And the number of COVID vaccine doses that you need is more than other people, because your body also has a hard time creating the antibodies if you have a weak immune system, and you need those antibodies to protect you from COVID. So in addition to the doses that people with healthy immune systems need, people with weak immune systems need an extra dose. So what does that mean? So that means if you are interested in, or if you have had the mRNA vaccine, like from Pfizer or Moderna, you will start with your 2 doses. But those 2 doses are not enough to get you the same response that people with a healthy immune system have. You need to get 3 doses to get you started. So you'll do your 3 doses, and then you'll get the booster shot 5 months later. So again, if you're currently undergoing chemotherapy, if you have a weak immune system for any reason, you are likely going to need more doses than people need for the COVID vaccine. If you'll need more doses than what a person with a healthy immune system will need. So if you have more questions about that, just check with your healthcare provider so that they can let you know what to do. But we want to make sure that you are doing everything you can to protect yourself from this crazy, crazy disease. So next, I want to let you know that my very good friend, Dr. Renee Jones, is here behind the scenes helping us to answer those hard questions. So she'll be keeping an eye on the chat and helping to respond to questions if we can't get to it on live. Now, I'd like to introduce you to our guest for today. Now, y'all know I'm bringing on people who I actually know so I can make sure that y'all actually get good quality information that you can trust. And so I've known Nicolle for many years now. We actually have had the same mentor for all of our adult lives. That is none other than Mrs. Delois Collins of the Swarthmore College Upward Bound program. Nicolle was a student in Swarthmore College Upward Bound program during her time, and then I was a student during my high school years. And so Mrs. Collins actually introduced us a number of years ago. And since then, we've been working together, we've been collaborating, partnering, and supporting each other from day one. So let me introduce you all to Nicolle. Nicolle Surratte is the founder of Inspired LLC and a health coach for me, two different organizations that she has found. She's already showing how phenomenal she is. She is an inspirational speaker, she's an author, health advocate, and an integrative nutrition health coach. She uses a holistic approach to health and wellness where she helps women decrease stress, increase self care, and make transformational life changes. Welcome to the show, Nicolle.
Thank you so much, sis, for having me.
Yep, of course. When this topic came up and I knew that we needed to talk about cancer today, we were going to talk about the clinical trial process, but I had to move that one back a week. I said, we're going to talk about cancer today because this is just crazy. So when I thought about the topic, I immediately thought of you. So thanks for answering and responding and telling me, yes, you'll absolutely do it. So let's just jump right in. Um, we found out that Tracy Braxton unfortunately passed away of cancer over the weekend. So I'm just wondering, like, what is the state of cancer in the Black community? Like, how many people are dying? How many people are, coming up with a cancer diagnosis? How does it look for the Black community specifically?
I'm glad you asked that question, and just stimulates the teacher in me to go do some research. So I did my due diligence and I checked out the American Cancer Society's update on those numbers. And at this point, Black Americans, 42% will be diagnosed with cancer this year, and 45% will die from cancer this year. So when we're talking about the 40s, 45, we round that up to 50. That's a lot of people. That's a lot of people. So we're looking at over 224,000 new cases this year and almost 74,000 deaths this year.
Wow.
And even, yeah, those numbers are astonishing. But what's even more kind of unbelievable, Kristin, is that there are so many modifiable things that we can do so that we don't even come in that bucket as being diagnosed, much less losing our lives to cancer. So, I'm glad that we're having this conversation because, what we don't know is literally killing us. So we need to, deal with those potentially modifiable risk factors, and we can make a shift, not only in current generations, but as you alluded to earlier, in future generations. And
Yes.
so that's really important.
Absolutely. And we are going to talk about what are those things that we can change, that we have to change, that we will change to make our lives healthier, to make our communities healthier, and to make our families healthier. So we're going to talk about that for sure. But just kind of looking at these numbers. So you said about this, it's expected for about 74,000 Black people to die of cancer in this year alone. And I just kind of want to compare that to what COVID has been doing, because it seems like we just get it worse in everything.
Mm-hmm.
So when I looked up how many Black people have died of COVID since the beginning, we're at about 135,000 cases, and it's been about 2 years. That is crazy. And it's about, if you look at the numbers, it's about the same number of people per year who's expected to die of cancer as well. So we cannot continue to be losing our people from conditions and diseases where we can make a difference. There are some things that we cannot change. We cannot change our genetics, but there are some things that we can change. We can change the decisions we make, how we move, how we live, what we eat, and what we do to prevent ourselves. Now, trust me, I didn't want to get the COVID vaccine either, but once I got the information I needed, I started to move in that direction. And now I feel like I don't have to worry about, am I going to die from this disease based on what we know now. And so
Mm-hmm.
we have to do the same thing with all these other diseases. It is just taking the information based on what we know now and making decisions that can prolong our life. So thanks for sharing and for looking up those numbers. Now, I know that you are a cancer thriver. Isn't that what you say? I'm not
Yes,
a
ma'am.
survivor, I'm a thriver.
I'm a thriver.
So tell us about your experience with having cancer.
So I'll be celebrating my 11th cancerversary in June. So
Woo!
excited about that.
Congratulations.
And
Wow.
thank you, thank
Congratulations.
you. And based on how I have been taking care of myself since high school, the diagnosis was very much a surprise. So growing up, I carefully monitored what I ate. I worked out regularly. I never drank. I never smoked. So to get a diagnosis was shock number one. And then for it to be an advanced breast cancer diagnosis was shock number two. But I'll say, Kristin, that I knew from the beginning that there was purpose in my diagnosis. And it took me a couple years to figure out what that was. But when I figured it out, I got it. And it turned out to be on this platform promoting health and wellness as a lifestyle. And so I am very much involved in the cancer community in Delaware, but also across the country, as a spokesperson for the Cancer Treatment Centers of America as one of their ambassadors, and also an ambassador for Susan G. Komen. And just to provide information not only to people locally and across the country, but I really enjoy the work that I do on Capitol Hill, because your viewers, your listeners might be surprised to know that there are bills sitting on their desk collecting dust. And we need them to pass them so that people can get the help that they need, and especially people of color.
Yeah.
As it relates to screenings, different types of screenings, even just some of the logistical things. So for example, there is a bill where, and we're still trying to get it pushed past, where your medical insurance will pay for you to have chemotherapy through an IV, but they won't pay for chemotherapy in the pill form because it's considered a medication. Well, so now, number one, going through chemo is traumatic enough, but to have to travel to a place and go to an infusion ward versus taking a pill in the comfort of your own home, you would want somebody to be as comfortable as possible. But there are people who would be better served by a pill who are being forced to go to get an IV because of logistical legal things. So, I'm just trying to be a voice out there, trying to make a difference so that we can get to a point, Kristin, where we are no longer having conversations about cancer.
Yeah. So thank you for taking your experience and making it into something that has changed so many lives already, and that will continue to change lives, because that's huge. So people hearing from you directly and really being able to relate, to them, I think is a real, is critical. I want to ask you real quick, did you get the COVID vaccine?
I did. And I, like you, I was hesitant to get it. I am not a pill popper. I mean, if it wasn't for the fact that I had to do chemo, I would not have done chemo. My thing is, what else can I do through my diet, through exercise? Let me go that route first. But I listened to tons and tons of webinars and presentations that were given by women of color who are doctors, and breast cancer patients, and from pharmacists and things like that. So it took me a while before I got ready to do it. And I'll tell you what really pushed me to get it done is that both of my children, they are in their 30s. They are world travelers. And I knew that if I wanted to see my children, I was going to have to travel, which meant I was going to need to get the vaccine.
Yeah.
So, I got them and I'm boosted up and all of that. And, it's an individual decision, but I just felt like that was just the best choice for me and what I wanted to do. And my thing is, when I got my diagnosis, Kristin, I wanted to live by any means necessary. And if
Absolutely.
getting the vaccination was going to help me live a good quality of life. Now, yeah, I want to have an extended quantity of days on earth, but we also need to think about our quality of life.
Mm-hmm.
And so for me,
Absolutely.
and I love to travel, that was really kind of what kind of pushed me over.
Okay. All right. Well, I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100, because that's what we do.
Keep
We,
it 100.
we don't want to pretend that it's all good and everything is perfect, because it's not.
Mhm.
So thank you for being honest. Renee shared some information in terms of Black women being 41% more likely to die from breast cancer than white women. That's a big deal and a big pill to swallow. I'm also wondering, are there any statistics like that for Black men as well?
Yes, yes. Actually, one of my bosom buddies, who is a mover and a shaker in the field, she's actually doing something this evening, and I did a little research on it. So that numbers are. So let me back up a little bit.
Okay.
So Black Americans have the highest death rate and the shortest survival of any racial or ethnic group in the United States for most cancers.
Wow.
And so, with the information that Renee shared, where were my notes? So, cancer is the number 2 leading cause of death in Black women and in Black men.
Oh, wow.
And it is number 2 to heart
Heart
disease
disease.
in
Yeah.
both of those cases, both of those genders.
Oh, wow.
And so, when we talk about high rates in breast cancer, there are also high rates in colorectal cancer, because you mentioned Chaz Bozeman.
Yeah.
Colorectal cancer, Black women are 19% more likely to be diagnosed than their white counterparts for colorectal cancer, and 34% more likely to die. For
Wow.
men, 24% more likely to be diagnosed than their white counterparts, and 47% more likely to die.
All right.
So,
So this is crazy. Let's talk about, how do we prevent these deaths? How is a person supposed to know that they have cancer? How do people find out? Are there any screening recommendations, especially for the ones where we have the highest chances of death? Colorectal cancer and breast cancer, prostate cancer. What are the screening recommendations? When should we be going to the doctor to say, screen me for this, check me for this?
right. So, what's very interesting about that, Kristin, is that the screening rates, so for example, for colon cancer, screening time is around 50 that
50
you should
years
get
old.
right.
Okay.
But the rates for colorectal cancer are increasing in Blacks for under 35. So our
Wow.
numbers are high with the
Wow.
ages being low, but we're talking about roughly 15 years before the screening is supposed to start.
Wow.
So same thing with breast cancer, especially a type of breast cancer called triple negative breast cancer.
Oh, yeah.
So the American Cancer Society says 45 to get your first mammogram for a person who's at average risk. But we're seeing triple negative breast cancer rates on the rise for young women of color. So I'm talking about women who are, in their 20s being diagnosed with triple negative breast cancer.
Wow.
And in situations, Kristin, where something didn't look right, it didn't feel right, they went to their OBGYN or whatever, whoever their primary care physician was, and the doctor said to them, "You're too young for breast cancer. Come back and see me in a year."
Yeah.
And so they did that. And when they went back, not only was it breast cancer, it was triple negative breast cancer, and now they've lost a year of treatment.
Mm-hmm.
So I say all of that to say to your listeners and your viewers that nobody knows your body like you do.
Yeah.
So in a way, as a one of the easiest things that you can do is to advocate for yourself. If something doesn't look right, something doesn't feel right, and you get that type of response from a doctor, oh, it's nothing, you're too young, go find another doctor.
Absolutely.
You are entitled to a second opinion, a 20-second opinion. You need to know what's going on, and nobody knows your body like you. So get to know your body.
Mm-hmm. And especially if you have if you are at higher risk because it runs in your family, then you want to be especially vigilant, especially staying on top of it, and especially not letting any healthcare provider brush off your complaints and your concerns and your symptoms. You need to find another provider and get another opinion, because it sounds like there's a mismatch between when they recommend the screenings to be done and what's actually happening in the lives of real Black people. Like, our diagnoses are coming before the recommendations are set. So if the recommendation is to get a colon cancer screening at 50, but in the Black community, more people are being diagnosed in their 30s and in their 40s, then they need to reset the screenings, at least for Black people. But now y'all know. So now you know to be looking out for changes in your stool and blood in your stool and stomach pain and things like that. And considering I need to get a colon cancer screening before the recommendation. Now, the problem that you may run into is insurance companies may not pay for it because if it's not aligned with the recommended screening time. So you may have to do a little work to get it covered. But Renee also shared that some insurance companies will provide gift cards and other incentives if you get your screenings done. So bottom line is, pay attention to your body. Talk to your doctor about it. If you're not happy with their response and you know something is not right, get a second opinion and a third and the 27th, like Nicolle said. Now, I want to go into some specifics in terms of what we need to eat, what we need to avoid. I know that a lot of cancer risk can be decreased based on the foods that we eat. And so, Nicolle, what are you telling your clients in terms of foods to eat and foods to avoid to decrease cancer risk?
So by the time this airs, a whole lot of people may not like me, but that's okay.
No, we're gonna love you. We're gonna love you because we're gonna make some changes, small changes, so
yes,
we can have lives together.
Yes, and I'm glad you said that. Small changes, because small changes over an extended period of time can just amount to great results.
Yeah.
And we really have to shift kind of what we're eating, how we think about food. And so I tell people to eat a plant-based diet. And you know what? I don't even like to, let me back that up. I don't even like to use the word diet, Kristin, because people hear diet and they think, oh, yeah, I can go on a diet for 2 weeks.
Mm-hmm.
Well, that's what they say. But what they're thinking is that on day 15, I'm going to get the biggest rack of ribs and the biggest bucket of cheesy fries, because they think after 14 days they can go back and resort to old habits. It really needs to be a lifestyle change, lifestyle change. And so we really need to be eating foods that are packed with great nutrients as opposed to nutrient dense foods, those snacks. And I've heard it said that eat food that comes from plants and not foods that are made in plants.
That's a good one. You
you
always got away with words. That's a real good one.
So we want to eat foods that come from plants, that real food. and avoid foods that are manufactured in plants. Because, it's just kind of an oxymoron. Junk food. How can it be food and junk at the same time? So we need to be eating lots of fresh fruits and vegetables. And I know people have heard the terminology, eat the rainbow. Yes, eat the rainbow. Not just one piece of fruit a day or one serving of vegetables a day, but at least 5. If you can do 7, if you can do 9 all the time, and with every meal. You can have spinach with your eggs if you're eating eggs. You don't have to limit it like that. Eating whole grains, eating legumes. We're talking about beans and peas because they're high in fiber. And the benefit of fiber, which is that fiber will take, those toxins and pass it out of your system. So we want to eat foods that are high in fiber.
Can you give some examples?
Sure. Of foods high in fiber?
Yes.
Sure. Beans, high in fiber. So they're also high in sodium. So if you're doing something that's canned, you want to make sure that you're rinsing things off well. You've got all kind of pressure cookers and slow cookers that you can do your own beans. You can buy the dry beans and do it that way. So they are high in fiber. Dark green vegetables, high in fiber. So we're talking about spinach, kale, chards. Those are great things to add.
Greens, collards. Now you can't cook them all day. You can't cook them all day long.
Yes.
And think you're going to get all the nutrients. But collards are good.
And you're right. So maybe we need to switch up how our ancestors have cooked them in oils, with ham hocks and greasy things that are clogging our arteries. So we can change the way we cook those traditional meals so that they still taste great and they're still good for our bodies. We definitely want to limit red and processed meats. So I'm talking about, and I know it's getting ready to be grill time, but we're talking about
fire up the barbecue,
the hot dogs, the sausages, the bacons. Those are processed meats. The lunch meats, high in sodium, high in fat. Watching those things that if you're going to have something from an animal source, it needs to be lean cuts, and to do everything in moderation. You want to limit high fat. So we're talking about dairy products, cheese, butters, cream. Watch those sugary sweetened beverages. As we talk about sugars, we don't always talk about the liquid sugars that we consume. Watching those highly processed foods that are high in trans fats, baked goods, microwave popcorn, fried foods. And I'm going to have to throw this one in there, Kristin. We need to limit our intake of alcohol. If you can avoid alcohol altogether, that is better. But the recommendation is 1 drink a day for women, no more than 2 drinks a day for men. But I say all of that to say that studies are showing that women who are consuming 3 or more drinks a week are increasing their risk of being diagnosed with breast cancer.
Wow. That's real. That's real. So 3 or more drinks a week, we see it in the numbers, in the studies. These women have higher risk of breast cancer. And this is all women?
I'm going to say yes, increasing your risk of breast cancer in women.
Okay, so that was for all women in general. And we know that Black women are almost twice as likely to die from breast cancer than white women. So we already have the odds stacked against us. We do not need any help. So as much as you can do to incorporate one of those things, I know we're out of time. Nicolle gave about 15 different foods that you can change, either to add to what you eat or to take from what you're currently eating, to make some changes. Pick one thing. We always recommend small changes. So pick one thing and work on that. Renee put a few other foods in the chat that has high fiber. A half a cup of almonds has 8 grams of fiber. That's a lot. I didn't know that.
It's a lot of fiber, but almonds are high in fat.
It is high in fat.
You have to make sure you're not overdoing it.
Yep. It's true. It has healthy fat,
Correct.
which is good, but it's still fat that can add on the calories. So we'll have to do another session on good fats and bad fats and healthy fats and all that. But this was really good information. So y'all gonna have to rewind and slow it down and take some notes to catch all the foods that you need to change in what you are currently eating. So I
Kristin,
want,
before we go,
yeah,
could I say one more thing?
yep.
So the title of this was "The Challenges Change," right? And you know me, I'm the acronym queen. So I thought about this last night as I was tossing and turning. What can I leave your viewers with? So as you think about the word change, have conversations with your doctor. About what medications you're on and things like that. We need to have conversations with our doctors. History. You need to know your family history. So after you have those conversations with your doctors, have conversations with your family about family history. You need to know what people are passing from at what age. Advocate for yourself. You know your body better than anybody. If you need a second or third opinion, get it. If you need help, ask. If you don't understand something, ask somebody. If you need help paying for some of your screenings, some of your testings, financial help is available, but you need to ask. Get educated. You need to know what's in your foods. We need to be educated consumers, be proficient in reading those labels, and eat to live instead of living to eat. We need to eat as if our lives depended on it, because it truly does.
Wow, that was good. That was good. So I hope you all were listening and taking notes. Renee also shared with us that only about 10% of Black adults consume 3 or more servings of vegetables a day. And Nicolle already just said we need to get 6 or 7. So we only have 10% who's getting 3 or more. I know I'm a part of that 10 because I'm probably getting about two servings of vegetables a day. So I need to get my life together as well. So I'll be doing these changes that Nicolle mentioned and trying to figure out how I can incorporate more fruits and vegetables in my diet as well. So thanks, Nicolle, for coming on now. If people have questions or want to reach out to you, how can they get in contact with you?
You can go to my website, ahealthcoachforme.com. If you're interested in a 30-minute complimentary self-care consultation, happy to do that. There's also a form there where you can just send me some information if you want to talk. I am on social media, Instagram, a health coach for me. I'm on Facebook. And, I'm just trying to help people make a change. One step at a time.
One step at a time. That's how you do it. Thank you, thank you, thank you. If anyone has questions about the COVID-19 vaccines or anything we talked about today, you can always call or text me at 267-322-0470, 267-322-0470. Call or text. If I take a while to respond, just wait longer. I will definitely get back to you. And if you have questions in the chat, we are going to go through the chat and make sure all of your questions got answered today. So thanks, Nicolle, for coming on. I really appreciate you being available. It's good seeing you. Haven't seen you in a little bit. So thank you.
Thanks for having me.
Bye.